In today's video, I'm sharing how one of my subscribers reversed CKD using natural treatments and the most effective way to beat swelling naturally. Plus, we'll answer the question, does your body actually need natural sea salt? This one comes from a subscriber named Weha Kam, who recently left me an incredible comment. Thank you. I just came back from the hospital for my 3-month kidney checkup. I'm a stage 3A CKD patient. Back in February 2025, my eGFR was 49. But now my creatinine is 97 mol/L, and my eGFR is 72. I'm so happy it feels like a gift. Now, let's put that in perspective. His GFR jumped from 49 to 72 in just 3 months. That's not just a gift, that's like rewriting your future. Honestly, reversing CKD is closer to stealing fire from the gods than winning the lottery. Massive congratulations, Weha. So, how did he do it? Here's the breakdown. He followed a strict low-protein, plant-based renal diet, fruits, vegetables, and zero animal protein or salt. He added a powerful herbal tea, astragalus root, cordyceps flowers, plus CoQ10, 150 milligrams, daily for 3 months. This combination of disciplined renal diet paired with astragalus and cordyceps isn't just folk wisdom. These herbs are among the most scientifically validated natural therapies for CKD. And Weha's results prove it works. A big thank you to Weha Kam for sharing this inspiring story. And since we're on the topic, let me give you something practical right now. A simple way to prepare an astragalus and cordyceps decoction. Now, I know decoction sounds a little mystical, like something out of a wizard's handbook, but trust me, there's no magic spell here. A decoction is simply a traditional method that naturopaths use to pull out the full potency of powerful herbs. Think of it as tea on steroids. Go ahead and take a screenshot if you want to save this recipe for later. It's not sorcery, but when it comes to natural remedies, this is about as close as we get to it. Now, let's move on to today's main focus, your questions. And it's only fair that we start with a question from the very person who just shared his success, Weha Kam. After telling us about his huge improvement, he also added this, except my sodium was very low, 131 millimoles per liter. Now, that's not phrased as a question, but it raises a very important issue that many kidney patients face often without realizing it: low sodium levels. So, the real question becomes, how can we safely increase sodium levels in lab reports? And let me be clear, this is not a small thing. Sodium is one of the most essential electrolytes in the human body. If it drops too low, that's a red flag you can't afford to ignore. You might already be thinking, well, isn't he on a low sodium diet? Maybe that's why his sodium is low. It seems logical, right? Stop eating salt, and your serum sodium falls. But, as you're about to see, the truth isn't quite that simple. So what's the solution? Eat something savory? Well, not exactly. And please put down that bag of chips you found at the back of your cupboard. Not only did it expire in 2016, but it also won't solve the problem. Let me explain why. When sodium is low in your lab reports, there are usually 2 main reasons: medications, especially diuretics. Certain drugs, like thiazide diuretics, can lower sodium levels. This does happen, but it's not the most common cause in CKD patients. Fluid retention, this is by far the most common reason. In kidney patients, low sodium usually means your body is holding on to too much water. That extra water dilutes your sodium levels, giving you swelling, puffy legs, edema, and even lung congestion. So, if you eat that old bag of chips, what happens? Besides questioning all your life choices, your body will retain even more water. More sodium pulls in more water, which means more swelling. Trying to fix low sodium with chips is like trying to stop a tsunami with a water balloon. It just makes no sense. In short, low sodium usually isn't caused by eating too little salt, it's caused by too much fluid in your body. Now, the real question becomes, what do you do if you're swollen and bloated? This is something another subscriber, Irene Francisco, asked. Of course, your doctor might prescribe diuretics, and in stage 5 CKD, they may even suggest dialysis because the truth is, fluid can only leave the body two ways, through the kidneys or through a dialysis machine. But here's what doctors rarely talk about: natural diuretics. These can help your body release excess water safely, without harsh side effects. And for many CKD patients, this is a game changer. So let's take a look at some of the best natural diuretics. Beetroot, fantastic for high blood pressure. In early CKD stages, a cup of beetroot juice a day can help with swelling and blood pressure. In later stages, it's safer to use the extract, to avoid extra potassium. Rosehip extract works beautifully alongside beetroot. Astragalus membranaceus, one of the most powerful kidney-protecting herbs, effective against swelling, high blood pressure, anemia, and even proteinuria. Hibiscus, when combined with astragalus, it can lower blood pressure so effectively that some patients reduce their need for medication. A quick note: don't combine beetroot with hibiscus or dandelion, because that could push your potassium too high. Stick to safer combos like beetroot plus rosehip, or astragalus plus hibiscus. On your screen, you should see a table with dosage recommendations both for extracts and natural forms. Depending on your needs, combining 2 or 3 of these remedies often works best. And that brings me back to the bigger point. Every CKD patient is different. Stories like Weha Kam's remind us why one-size-fits-all advice rarely works. This one comes from Lawrence99, who says, "You have got to do a video on salt." I guess that's what we're doing right now. He adds, "Sometimes you say minimize sodium to the bare minimum, and now you say stop. What are we supposed to believe or follow?" Lawrence, I can feel the passive aggressiveness radiating through the screen. Which probably means one thing: you've got high blood pressure. Step away from the salt shaker, my friend. Now, let me show you something. This, what you see on screen, is all the salt you need for an entire day. Not for breakfast. Not for one meal. For the whole day. And here's the kicker: almost 100% of people watching this are already eating way more than that, even if they never touch the salt shaker. The American Heart Association recommends no more than 2,300 milligrams of sodium a day, and ideally no more than 1,500 milligrams. But let's be honest, 1,500 milligrams is about the same amount of sodium you inhale just walking past a McDonald's. To put it in perspective, 3 small slices of bread, that's already around 500 milligrams of sodium. 1/3 of your daily limit, gone. And bread isn't even the worst culprit. Canned soups, vegetable juices, salad dressings, pickles, and especially tomato sauces. A single serving can blow past your entire daily allowance. So here's my bottom line: nobody is getting too little sodium. Not unless you live off the grid, farming every bite of food from your backyard garden. For the rest of us, the challenge is not avoiding sodium deficiency, it's avoiding sodium overload. That means your goal should always be, get as little sodium as humanly possible. Especially be cautious with packaged foods. They're often more stuffed with sodium than a subway car at rush hour. Aim low, because trust me, you'll still be getting plenty. So no, don't worry for a second about eating too little sodium. It just doesn't happen. Now, let's shift gears to something closely related, sodium bicarbonate. Here's the question: can you take sodium bicarbonate if you have high blood pressure? Great question and very relevant, because yes, sodium bicarbonate contains sodium. And we just established how little sodium you need per day, right? So what happens if your doctor recommends sodium bicarbonate? Is it safe? Here's the truth: if your doctor prescribes it, take it. Not only is it safe, but it can actually help. Why? Because doctors only prescribe sodium bicarbonate when your serum bicarbonate levels are low, and almost always in conservative, low doses. In fact, I see far more patients who need sodium bicarbonate than patients who are overprescribed it. Why is it so important? In CKD, sodium bicarbonate is used to treat metabolic acidosis, a serious condition that accelerates kidney damage, eats away at your bones, and breaks down your muscles. Left untreated, it speeds up CKD progression dramatically. Unfortunately, some doctors take a wait-and-see approach, even when patients could benefit from treatment. That's a mistake. So let me be clear: if your doctor prescribes sodium bicarbonate, take it. It won't make your blood pressure worse, and it could literally save your kidneys. Worried about the sodium content? Don't be. It's safer than whatever you stirred into your coffee this morning. Just treat it like what it is: a medication, not a supplement, and you'll be fine. Alright, next question, and honestly, this might be the most common one I get. Can I take, insert trendy salt product name here? Every day, my inbox and comment section are flooded with variations of this. What about electrolytes? Is Himalayan salt healthier? Is Redmond's real salt good for you? What about Celtic sea salt or seaweed salt? And every day, I seem to learn about 2 or 3 new miracle salts. If people put half as much effort into managing CKD as marketers put into rebranding sodium, dialysis clinics would be empty by now. Here's the truth: salt by any other name is still salt. And if you have CKD, it can be dangerous, literally life-threatening. Too much sodium raises your risk of heart disease and stroke, which are already the top causes of death worldwide. And here's the kicker: your body doesn't care if the sodium came from a Big Mac, a pink crystal mine in the Himalayas, or a fancy natural brand marketed online. To your heart, it's all the same. So why is sodium bicarbonate different? Because it's not a seasoning, it's a prescribed medicine used to treat metabolic acidosis, a serious condition that speeds up kidney damage. Sodium bicarbonate has a clear medical purpose. Himalayan salt? The only thing it improves is the bank account of whoever sold it to you. So, let me make this crystal clear: don't take Himalayan salt. Don't take Celtic sea salt. Don't buy electrolytes marketed as health hacks. With the exception of sodium bicarbonate prescribed by your doctor, if it's salt, it's harmful for CKD patients. And please, don't confuse YouTube popularity with medical truth. The people pushing these products don't care about your kidneys, they care about your wallet. So that's the bottom line. That's everything you ever wanted to know about sodium, but maybe we're too afraid to ask. Thank you for watching, take care of your health, and God bless.